Immersive Medical Podcast. I have a very special guest for you today. It is Bob Fine from the International VR and Healthcare Association, also known as IVRHA. Bob, welcome to the show.
Devin, thanks for having me. It's great to be here.
So we wanted to have you on the Immersive Med Pod today because you kind of are the perfect crossover of immersive and medical, which is kind of our core concept. So tell me a little bit about what IVRHA is and what you're doing for the community.
Yeah, so I guess just to provide a little context and background, I've been working for myself since 2010, and I actually organized what was the first social media conference on the East Coast back in 2009. I did a number of events that year. I had a book come out about applied social media. It got picked up as a textbook about 10 universities. And then I launched what's still today the only print magazine about social media called Social Media Monthly. But I was building a large subscriber base. We were doing well. I was selling print advertising. It was also, we had a sister website. We were doing, webinars. It was a lot of different things. In any case, ended up having to kind of shut that part of the business down around 2013, 14. I had a couple lean years. And after the Oculus Kickstarter came out, and after that launched, and then, they shortly got bought by Facebook for $2 billion, just a little pocket change for Facebook.
Right.
People were reaching out to me and asking what's the intersection between social media and VR? And I always kept an eye on VR I've been a long time video gamer, so I always kept an eye on it from that standpoint. And I started experimenting and doing some different one-off events in different verticals back in 2016 and 17, and trying to see where the interest was. So we did VR and architecture, VR and defense, VR and entertainment, VR and higher education. And we did the first VR and healthcare events in June 2017, more than 7 years ago now, at George Washington University Hospital here in DC, where I'm based. And that was I would say that was a good success compared to the other experiments in terms of the verticals. And a gentleman I met who presented, Dr. Walter Greenleaf from Stanford, who's been working in the space as a researcher for 30 years, helped me organize a second event, which we did at Harvard Medical School in March of 2018.
These are digital or in-person events or digital events?
These were in person, both in person. Yeah. And all the experiments were in-person events.
Got it. I wasn't sure because you said VR, and sometimes these are all with a headset on your face.
But the interest is, so just on that point, sometimes, why don't you, this is all about VR. Why don't you do the conference in VR? And because one, we're not quite there yet, where there's a lot of friction to that.
Yeah.
The other thing is, if you're able to participate in a conference in VR, you're probably not the people that we're trying to get to come to the conference anyway, because we're trying to convert the unconverted. So anyway, that event at Harvard, we had 250 attendees. It was a huge success. It felt like some kind of, a moment for the industry, at least as far as healthcare was concerned. And so I thought, maybe healthcare is the sector to focus on. I don't have a traditional healthcare background. My background is engineering, IT, environmental science, and policy. And but my father's retired OBGYN, so have been exposed to it.
Sure.
And I had a year-long conversation with HP in 2018, and they agreed to be a founding member of the association at the end of that calendar year. And so we formally launched it in March 2019 at our third annual conference, which we had at the University of Arizona in Tucson.
That's where I'm from.
And we, is that right?
Yeah, born and raised.
I'm sorry about the Diamondbacks.
Oh, I know they lost the World Series, but what are you going to do? You know what? I'm proud that they made it. Anyways, continue with your story.
So we launched with 40 founding member organizations back in March 2019. And it's been just letting it grow organically. And today we're at about 120 member organizations, and about 30% are outside the U.S. And that is the kind of the origin and how IVRHA came into being.
So, VR and Healthcare Association. So, can you tell me a little bit about like what is your goal or the intention of the conference? I know you said it's to convert the non-VR, which is why you do it in person, so people, I presume, can get an idea of what it means to engage with an immersive platform or an immersive piece of hardware. But what is the intention of the healthcare sector of IVRHA?
So we have two main missions for the association. One is supporting our members any way we can, and I find that varies greatly from a two-person garage startup to a teaching hospital or university.
Gotcha.
What's also challenging, makes it fun, and interesting, is those needs are also always changing. So as that two-person garage startup, grows a little bit, maybe they get their seed money, their Series A, they have different needs and different problems that they're trying to solve or attack.
So these are companies, not like individual healthcare people interested in
right.
VR.
Yeah. So the association is an organizational level. I had to make a specific decision at the beginning, whether to do individuals or organizations, and it was just it would take a lot of scale for it to work, with individuals.
Yeah, I think Facebook Meta is facing that right now, right? They're trying to scale VR, and they're one of the biggest companies on the planet, and they're having a hard time with the Quest. So, please continue.
Well, they are, yeah, but I think there's some specific. Well, there's some reasoning behind that, and there's some problems internally at Facebook that's making that struggle. But in any case, but each member organization can have up to 100 participants or staff people participate in the membership. So that's kind of, it's more, I've never had any organization use more than 10 or 20. But anyway, so the other half of the mission is to educate the market, is to, educate physicians, nurses, practitioners, not patients. That's too large of a population for us to focus on, but the healthcare professionals are large enough population as it is. So keep in mind, healthcare is 20% of the U.S. economy. And if I had to, I just gave a presentation last week, and I've updated this number over the years, and I started at 99%, and I'd say maybe we're now at 90%. But I think it's pretty safe to say that 90% of the entire healthcare community is not familiar with VR and does not know or understand what the opportunities are from VR in healthcare. And the other thing also, just for my AR, MR friends out there, I am, when I say VR, I am talking about immersive today. So we are technology agnostic.
I understand.
Now,
Gotcha.
now, if you're interested, I can give you the reasoning why it's still called IVRHA and VR, and I have some personal.
And I have a follow-up question for you, but tell me, why is it still called IVRHA VR if you are basically
So I'm a strong believer that there was a number of years where the industry kept coming out with new acronyms and new name changes, and a lot of people don't realize that MR, mixed reality, is a term that came about from Microsoft when they launched their OEM headsets in 2017.
The HoloLens, right?
No, not the HoloLens. Microsoft had OEM VR headsets that were sold by Samsung, Dell, Acer. There were a couple others. But the ironic thing is, these are VR headsets, but they felt they needed some kind of differentiation in the marketplace, and they called them mixed reality headsets, which was completely off base. And also, that doesn't help. That just confuses people in the industry.
And did they even have pass-through where you could literally mix the reality?
No,
that's amazing.
There was I don't know how this happened internally, but it took hold. Now, the other thing is the reason, I started with IVRHA. I didn't want to change the name. Everybody was changing to MR or XR or what have you. The other thing is I'm a strong look. I think that the general public and the media are most familiar with the term virtual reality VR. It's been a term around
Yes,
for
agreed.
many years. I don't think it's going to go away. I think, and when you have to explain immersive to somebody that's a layman, VR, virtual reality, that they quickly understand, or at least they can understand where you're coming from. But as soon as you say XR, extended reality, or you start saying mixed reality, or
Yep.
augmented even to a certain extent, it's not as easy to understand. And so that's why we stick with the name IVRHA.
Yeah, you I think are hitting the nail right on the head. I don't blame you, especially when there's such a high adoption curve for this new technology, this new hardware. So this brings me to the question that I was going to ask you, which is, why is it important for people in the healthcare industry to learn about virtual reality or immersive technologies?
Well, I would just point them towards the all the literature and all the studies that have taken place, going back 30 years, but even more recently in the last 4, 5, 6 years, in how the immersive can be used in different applications within the medical field. We actually put out a book 2 years ago that was a 2-year project and has 35 different case studies on different applied use cases of VR immersive in medicine. There's 63 contributing authors.
Plug that book. What is it?
It's I'm having a morning issue here. It's on Amazon.
We'll put it in the show notes for people.
Yeah, I'll put it in later. So where were we? Keep me on track here.
We're at the why. Yeah, we were at the why is it important, and you're
why?
talking about.
So I guess let's. I guess one, you're with VR patients, so let me plug that side of the application, which is education, or training for nurses. Specifically, from your company.
So this is like enterprise education training, upskilling. That's what we're talking about right now.
Upskilling, correct. But the other aspect, but that gets a little broader, as well as training, say, med students, nurses in college. And there's a lot of great data demonstrating that the learning retention in VR is higher, and the students learning how to do procedures is higher. It's at a lower cost. They can do things over and over again. The point being is that if you start applying immersive technology into the education of medicine, you're going to have better physicians and nurses at the end of the day. I'm
going to push back, but only because I'm a believer, right? So I already subscribe to that, and I agree. But I hear all the time people who just aren't convinced of that. And so here's the pushback. So this is like the devil's advocate pushback on what we're talking about right here, right? So you might hear someone say something like, yeah, but I want my doctor to actually practice on a real person because I'm a real person. I'm not an avatar, right? So how are they going to get better at treating me if they're going to learn in a digital environment? That's one argument, right? You might hear. Hit me.
So I'll for whatever reason, this one sticks in my head. But we did a conference in Dublin in 2019. We had the Royal College of Surgeons of Ireland present. They had done a study and they had collected data, and they put their orthopedic students through learning a particular procedure, both in the traditional way that they had been doing it for many years, sometimes on a cadaver, sometimes just textbook, this is the process. And then but then how to do, doing it in VR, picking up the tools, doing the procedure, being able to do it over and over again. And they found that, and the data was off the chart, that the ability of the students that learned it in VR versus the students that did it traditional methods, however they've been doing it for decades, night and day.
And I want to hammer on that for a second, because I think there's a differentiation that a lot of people don't understand, which is that there are augmented mixed reality VR applications where the physician might be doing like surgery, and they're actually utilizing it in real time for treatment. So maybe they're like trying to look through the skull, and they have like the MRI pasted onto the patient's head so they can actually see through what's going on, but they're in surgery. That
Yeah.
is not what we're talking about right now. What we are talking about right now is the more broader usage, because that's very, very focused usage of this type of technology. And I think that's what people think when they think of VR, is like that they're going to be treating people in VR. And there's this kind of learning gap that I want to help people overcome, which is that it is the time that you spend in these immersive platforms or in this immersive technology, that after that time there is a increased outcome because of what you're doing and practicing and iterating. Am I getting that right?
That's perfectly right. I'm curious. So, is feedback that you're getting when you talk to people that don't know anything about that technology, that they think that there's some kind of treatment in VR? Is that from the patient point of view? Is that from practitioner?
So we're talking more from the educator's perspective. There's sometimes a fear that they're going to be replaced by it, like as if the VR does the training for them, or as if the VR is going to teach the students for them, and that sometimes we'll put out some metrics about like improvement rates, and people think that, oh, so they improved patient outcomes because they were using VR in the field. And it's like, no, they were using it before they got into the field. They were using it when they got home from the field. When you get home from the hospital, or when you get home from nursing school, you then are iterating more. And it's this like constant simulation environment that really, really helps with retention and practice and also confidence.
Yeah.
And all of those things are normal educational foundations. You want to iterate, practice, and fail often in school. And then when you graduate from school, you don't get to iterate very often. And that's no longer the case with VR, because you can iterate at home. You can practice on actual, you can become a member of an association, and you can become a member of an institution or something like that, and use their cases and practice and iterate. Maybe the hospital has it. And I just think that sometimes there's a mental block with separating like in the moment virtual reality versus asynchronous virtual reality simulation. Does that make sense?
Yes. Yeah. That's again, that's why half of our mission is to educate people about it, and try to allay those misconceptions or concerns or fears, and what I found. Look, I've put going back to 2016 and doing those early events, and I put more people than I can count through Fruit Ninja.
Right, and just to get the feel.
Yeah, Fruit Ninja. It only takes a minute to play. Anybody can do it. All you got to do is swing your arm. But it's a great experience.
That one often.
Yeah, well, Beat Saber is a little. It takes a little bit of coordination, but swing a sword, anybody can do that.
Yes.
And I found that I don't think Google Cardboard was not.
Yeah.
I don't think helped the industry very much. I think it gave too many people a misconception of what VR was about, and it really isn't. Yes, you can do some great things on the phone, and the phone is a great deployment tool, and it's everywhere, but it's not providing the immersive experience that you get in a headset.
I just want to touch on that briefly, because in a headset you can watch a 360 VR video, which is again another term, XR, AR, 360 VR. Yeah. Right? But people should understand that those are pre-recorded. It's like watching a show. It's like watching a movie. So as far as the immersive engagement, I 100% agree with you. It's just not quite the same, and the cardboard usage wasn't quite there. But just so people understand, you can engage with 360 VR on a headset.
Yeah, and that's kind of where we are today. There's a huge amount of content out there that is very passive, and where the user is just watching, or I think 360 views are important, and they provide a place in the education, allows people to get a 360 view and look around, and they can watch people interacting, and there's a little bit of interactivity, but it's not the kind of training that we're talking about, and that is going to become the norm over the next 5 to 10 years. I mean, we're talking about Well, I mean, let's go back to, I don't want, not getting off of medicine for a second, but, KFC had a great, maybe really early, maybe 2018, they came out with a virtual reality training to teach their employees how to fry the chicken.
No way.
So, what better way to train new employees so they don't, because I mean, you're working with hot oil, you're already
Yeah.
running
Yeah.
a restaurant. I don't know how they train their employees, but but what a better, great way for somebody new to, a kitchen in a fast food restaurant. These are all the steps you do. Here's how you do it. Here, you take the basket out. You can learn what you're not doing right or doing wrong,
Yeah.
but now translate that to treating people. A little more complicated, a little bit
Well,
more
you know what
involved,
though? You
but
know
just
what though?
just as dangerous. You don't want to spill hot burning oil on a person.
Well, and just to speak to the medical aspect of it, we are finding that there are, well, not we are finding, there are known high levels of mistakes that are very, very simple mistakes. And it has to do with being
Oh
overworked
man,
or
I mean,
understaffed.
you're now bringing up an entire area that is not talked about very much, and is I
It doesn't have to
man,
be
I wish.
complex training.
No, but I wish I had the statistics in front of me, because medical errors are
Yes.
one of the biggest sources of people getting sicker when they're in the
Yes.
hospital, infection,
Drug
um,
interactions.
drug
Absolutely.
interactions. I mean, you can name it. And yeah, I mean, I think there's a reasonable fear for people not wanting to go into the hospital for
Yeah.
a procedure, because
And that's, yeah, yeah, go ahead.
yeah, no, but anyway, I mean, and actually, we had well, we're going to Pittsburgh next week. We
Yeah,
had
hold on. Before we get to the healthcare demo roadshow, I just want to hammer on the one more thing, which is that you were saying that this people, the medical errors. And I just want to say that that doesn't always mean like surgical or invasive errors, right? We're talking like clinical, critical thinking decision errors. Like,
yeah,
this is a simple one, but like checking for allergies before you hang a medicine, or checking what they're existing taking before you give something.
but
That and
let's
staff
go
on top.
quickly go to, here's another great application that's starting to take hold a little
Oh,
bit
please.
for VR, is on that same point, is teaching the medical technicians how to properly sterilize equipment,
Yeah.
how to clean and prepare it, and that is, I mean, you've got so many different types of very complicated equipment in the hospital, everything from an MRI machine to a scalpel, and it's a lot. And we're living in a situation where we have a lack of healthcare professionals. We're trying to recruit people more into the industry, and where they may not necessarily go through a traditional education method as in the past, because we have such a dearth of staffing. And but in order for people to feel safe, and for the environment to work, those people need to be trained properly, and they need to be given the time to be able to train properly, whether at home or at work.
Absolutely.
And yeah, I mean, and VR, is going to play a pivotal role in that, over time.
Well, we've only got a few minutes left, so let's talk about something. You're doing something new, right? That's the whole reason why we brought you on today, because there's something special going on, first time ever. Tell me about your healthcare demo roadshow or tour.
Yeah. So this, I've had this idea since getting IVRHA started more than 5 years ago, and because and one of the things, look, something I think about every day. One of the reasons we published the book, one of the reasons for the conferences, is how do we educate the market efficiently and in a timely manner and in a cost effective manner. How do you inform 20% of the economy about VR, so the industry grows and it takes hold sooner than later. So that's a challenge. That's and thinking about that every day. So one of the ideas that I've had is, it's hard to get people to come to an in-person conference,
Yeah.
for a variety of reasons. One, location, cost, time. We want those people to come to a conference, but there's going to be a very, very large, 99% of the healthcare market is not going to be able to come to the conference for whatever reason. So I believe that at some point, and starting next week, we have to bring it to where people are. And
I love
so,
this idea.
so the idea is, we've toyed around with ideas of, do we try to do an event within a hospital and do content and education, and yes, that may be a possibility. There's a lot more involved in organizing that. This next week is a pilot. We are going to 3 cities: Pittsburgh, Cleveland, and Columbus, Tuesday, Wednesday, Thursday, one day after the other. We have gotten space either within the hospital university system or very close to it. And we have now like 10 to 12, depending on the day, companies coming with us to demo their applications for anyone off the street, medical background or not, to come in and have a conversation, have an experience,
That's awesome.
learn about the technology. Now, getting the word out is hard for any event. It's free for people to attend. Our main focus has been trying to focus on, medical practitioners, university students. But, again, this can be anybody from that works in a hospital that has a private medical practice,
Sure.
or a medical lab. We're aimed at the entire healthcare community within that city. We're going to learn from this experience. The other thing is this a good use of time for the companies involved? Does hitting 3 cities, one right after the other, is that a good use of their time and money?
I'm excited about it. I'll be on the tour. I'm going to drive to here. I can tell everyone where it is. So we're going to go Pittsburgh first on November 7th, and that is at the Wyndham Pittsburgh University Center at 100 Lytton Avenue. Please go and check it out. It's free, and there are companies there that talk about how to clean and sterilize the actual VR headsets, to surgical applications, to healthcare, mental health, patient care. I see Healthy Sim's going to be there as well, and they are a huge voice in the industry. Then the second location's in Cleveland. That's at the Sears Think Box at Case Western Reserve University at 11201 Cedar Avenue. Go check it out. And that one's on November 8th. Also free. Come check it out. Come have a cup of coffee with Robert and pick his brain. And then you've got, with Bob. My apologies, Bob. And then you've got
Right.
Columbus.
It says Robert on my driver's license.
It does. It's November 9th, the third location, Columbus at the Hyatt House OSU, the Ohio State University at 633 West 5th Avenue. So November 9th. So that's what we got. November 7th, 8th, and 9th. Come check it out. What time of day is it? Middle of the day? It's like 10 to 3?
So each event is open from 10 a.m. to 3. People can come
Easter.
walk in off this. We'll take walk-ins. We'll actually have some signage on the sidewalk. We ask, if you can register ahead of time, so we know you're coming or can expect head count. And
sure
the easiest way, really easy way to do that with all the address information and the exhibiting companies is go to the website tour, tour.IVRHA, IVRHA, IVRHA.org. That's it. Tour.ivra.org. I couldn't make it any easier.
That's beautiful. All right, so we're going to put links to this location to register, or at least to figure this out. If you can't go, send someone, tell someone about it. This is, again, free. It's educational. It's supposed to help our healthcare. Yeah. And let me tell you right now, folks, if you've been like to the Immersive Medical Podcast, I'm selling you hard right now, because there is a healthcare shortage. There is a huge staffing shortage coming. It's a wave. It's 15 million healthcare providers over the next 7 years. That is too many. And we cannot get there if we don't produce more faster, and we can't do it if we don't engage technologies that allow our clinical educators to produce better healthcare providers and more faster. And so come learn from Bob and IVRHA. I know HTC is sponsoring, so you're going to get to put on the infamous XR Elite, which is sold out everywhere. And so they had to send us a demo unit. So thank you, HTC.
Oh,
We're going to have that with us. And check it out. Come play. Come have some coffee with
So
us
let me
at
add something to that, because you're talking about the shortage. If you're a parent and you have a teenager that maybe in high school, maybe 9th, 10th, 11th grade, and they're trying to figure out career paths or what they might, maybe they're thinking about medicine, maybe they're thinking about nursing, but they're not sure. We actually have high schools that are trying to start integrating some VR training into their curriculum to help give those. It's better to know early whether medicine is for you or not than get in med school and then decide it's not. Bring your
Kids.
your son or daughter and let them have an experience, give them an idea of where technology is going and what the opportunities are. That is what this is all about. It's about informing people, getting them excited, giving them a good experience. And because once they have a good experience, once they have one really good experience, the rest take care of itself. The wheels start spinning, and then they start, oh, well, we could be using it for this, or we could be using it for that. Now I see why there's so much, why Facebook's put so much time and money into it.
Yeah. And look, again, guys, we're not talking games. We're talking professional tools to make a real impact on our public health, on our healthcare system, on jobs, on workforce. Come and try stuff out. It's free. All right. Let's wrap it up. Do you have anything you want to say, Bob? Where can people find you aside from tour.ivrha.org? Where else can people find you?
I am really easy to find. I'm on LinkedIn. If you just look up Bob Fine, you can email me at bob@ivra.org, bob@ivrha.org. How else? I'm on Twitter, Bob Fine. I've been in social for a long time, so all my socials are usually just Bob Fine. And I try to make myself actually easily accessible. So if you want to reach out and talk to me, please do. That's what I love doing. This is the reason I started the association was so I could spend as much time as I wanted educating and talking and supporting our members and not having to look at the clock. And that is where I get my job satisfaction every day.
We are going to end it right there. That is beautiful. Bob Fine, thank you so much for your time. Can't wait to see you in person and shake your hand in Pittsburgh, in Cleveland, and in Columbus.
Weather looks to be nice next week. I think it's going to be in the 60s most everywhere.
I'll take it. All right, ladies and gentlemen, send this podcast to someone who cares, and we will talk to you soon. See you later, Bob. Okay, listeners, have you ever thought about the difference between simply editing something and truly authoring it?
Devin, that all sounds like the same thing.
Not quite, Connor. Editing is just making changes to someone else's content, but authoring, that's crafting something from scratch. With VR Patient's latest Infusions authoring tool update, healthcare educators can author their own intricate simulations.
That sounds empowering.
It is, but it goes beyond that. What you author with VR Patients, you own. Your creations are safeguarded as your intellectual property. Imagine being the architect of your own virtual training experiences, defining outcomes, and owning the rights to them forever.
So it's like having a patent on an invention?
Exactly. Clinical educators aren't just passive technology users. They are authors, innovators in their domain. With VR Patients, they're creating the future of healthcare simulation.
Incredible. For those looking to become pioneers in healthcare education, where should they start?
Begin your authoring journey and safeguard your creations with VR Patients. Learn more at vrpatients.com.
Remember, folks, the future isn't just about using innovations. It's about owning them. Dive in at vrpatients.com.